Hi guys, it's Sheena from Teton Raptor Center and I'm here to give you all this week's patient update, so let's go ahead and get started. I want to kick things off this week by highlighting our most recent release. This is Red-tailed Hawk 610, and this bird initially came in due to emaciation and a pelvic fracture, and he was released back into the wild on Thursday in Jackson, Wyoming. Next, we're going to move on to some of our current patients. Unfortunately, we just don't have the time in this video to cover every single patient, but we are going to cover some of the ones that you didn't get to see in the last couple of videos. Here we've got black-billed Magpie 731, and this bird initially came in from Jackson, Wyoming with a broken leg. We were able to successfully provide surgery to orthopedically pin that leg, and she's going to undergo a second surgery in about a week where we're going to remove that orthopedic pin and see how her mobility looks. So far, she's been able to get around really well, able to fly, and we've actually added this little shoe on her foot. If you look closely, you can see it there, just to keep her talons in a normal position and to keep her toes aligned appropriately. Next up, we've got our 3 American Kestrels. Now, these are all female Kestrels that came in roughly around the same few days, and they're also about the same age. So we do have them living together, and they are all working on live prey testing at the moment. Here's a photo where we brought each of these birds out to get an updated weight on them to make sure that they're gaining weight successfully. When you have several birds sharing one enclosure, you have to make sure that one bird is not the bully and is eating all of the food. So in this particular case, all 3 birds were eating and no one was bullying each other. They were getting along fantastically. So here they are in this photo with some of our volunteers and some of our interns getting them out for a weight check. Next up, we've got Golden Eagle 86, and this juvenile Golden Eagle came in from Green River, Wyoming. When he first came to us, we couldn't really find anything obviously wrong with him except for the fact that he wasn't able to fly. So it's possible he could have some sort of tendon, muscle, or ligament type of injury that we just can't see on x-ray or by feeling it. And so in these particular cases, we generally give a bird plenty of cage rest, and then after about 4 to 5 weeks, we try them in our flight barn and evaluate their ability to fly. So that is kind of the plan with this guy right here. We've only had him a few weeks on cage rest, so he's got a little bit longer to go. Here we have Swainson's Hawk 87, and this bird came in from St. Anthony. He's a juvenile Swainson's, and he was found completely emaciated. This can unfortunately happen to juvenile birds once they leave the parental care of mom and dad, just because they haven't quite figured out how to hunt successfully on their own, and that was definitely the case for this bird. The best way to combat that is to eventually move them in with an adult of the same species and live prey test them together so that the adult can kind of show the younger one the ropes. Here he is in the flight barn working on some flight conditioning. He's a beautiful flyer, and we're really excited because hopefully as soon as he catches live prey, we can get him out the door. Last but not least is Swainson's Hawk 825. This is our newest patient, and he came in due to right shoulder trauma. We're not exactly sure what happened to him to cause this type of injury, but we're thinking he may have been hit by a car or fell from a tree or something like that, since he is a juvenile bird. The treatment plan for him will be lots of cage rest and then also some oral anti-inflammatories to help keep him comfortable and to keep any pain and swelling down. Thank you guys so much for tuning in this week. I hope you enjoyed learning more about our birds, and I look forward to talking with you all next week. Bye!